Buenos dias. Mi nombre es Bob Ravenscroft, Vice Presidente de Bryan Health. Bryan Health ama a nuestros vecinos hispanos y latinos en Nebraska. Yo hablo un poco español. What I said was, good morning. My name is Bob Ravenscroft, Vice President for Advancement at Bryan Health. Bryan Health loves our Hispanic and Latino neighbors across Nebraska, and I speak very little Spanish. In fact, it was 4 semesters over 30 years ago. I greeted you this way to draw attention to Bryan's position. We care for all that come to us, and we have zero tolerance for racism at Bryan. And because we've received some critique in the past day about messaging in Spanish for our mobile clinic and on our mobile van. Saline County has about 25% of their population that is Hispanic. Lancaster County is approaching 10%. Bryan believes doing this is not only in the best interest of all of the public's health, regardless of their ethnicity, but it's the moral thing to do for our residents, employees, students of this great state that are vital in many roles deemed essential and for our state's economy, and to do this in a preferred language for so many of our residents. We have interpreters on site at our mobile clinic in Crete. They are being helpful, but ironically, and with this critique that we received in mind, the interpreters haven't actually been used as much as we thought, because so far this morning, most of our Hispanic patients have been bilingual. After the daily stats, John will let you know what's going on inside of Bryan Medical Center, and so far this morning, what's happening in Crete. And of course, we'll answer your questions. We do have a B-roll package of the mobile clinic in Crete that we'll also get out to the media. Our midnight census at Bryan was 366. The screening questionnaires completed through Bryan Easy Visit now are at 10,547. Our total easy visits have resulted in 3,252 people completing that, and now 1,519 have used the COVID promo code. For the testing numbers, in total, at all of our Bryan locations, we have now tested 2,355. We have 127 individuals that have tested positive, 2,084 negative, and we have pending results from 144. Drive-through remains big. Of those 2,355 tested, 1,700 of them have come through the Bryan drive-through clinic. So with that, John Woodrich, President and Chief Executive Officer of Bryan Medical Center.
Thank you, Bob. To give you numbers, we have 2 in-house patients that are pending their COVID results, and then 6 positive patients. 3 are from Lancaster County, 3 are from outside of the county, and we're down to 2 patients that are on ventilators. So I think the message is people are getting better, and that's a good sign as we catch this early. Bob talked about the Crete location. We're just getting ready to wind that down from early this morning. We think we've had about 80 people come through. We had the capacity of doing 160, but knowing that the National Guard did 100 yesterday, I think it's going to give us a good sample size. So we're very proud to be able to service folks in that area. I did want to comment, one of the other things we're continuing to work on is our elective surgeries and establishing that criteria of how we'll phase that in. We're still working with our physicians, continue to do that through today. We'll probably have an announcement by Monday morning in relationship to surgeries. With that, I would like to open it up for any chat questions that may come across. I think the reason for more positive tests, if you recalled, we gave our capabilities or increased our capabilities to about 110. In the last couple of days, we had seen over 90 individuals come through. So we had more pending that were out there. So we're at a little bit over 5%, probably like about a 5.4% positive rate. But I will let you know we did have a number of people come to our drive-through from Saline County. So I think we are seeing some of those positives that we believed we were going to see. You know, I think when we get these results back, some of the actions that are going to have to be taken is as we identify where these individuals have been and who they've been around, we want to make sure that we get those people notified and that We can also set up some type of system. If we find out that these people are living in areas or of tight quarters, it's not just about identifying who is positive and what organization they've worked for, because if those organizations take necessary steps to separate individuals, that's one factor. But I think the other factor we have to look at is living conditions that people may have. And if they are in close quarters, I think our next step is working with the health department and how could we provide some additional or alternative living conditions so that we could avoid this from spreading further. So that's part of getting this large sample size. It's not all just about identifying the individuals and taking care of them, but all the contacts that have been made, and to once again try to reduce the likelihood of this spreading to others.
No more than normal. It's just, a commentary on some of the unfortunate ugliness that we have to face sometimes. So the comments were not necessarily threatening. They were more kind of ugly opinions that were represented in both some phone calls and through social media. So no, we're not concerned with security, but we're always on alert for everything that society intersects with hospitals at one point or another. So security is I wouldn't say heightened because of this. It's just omnipresent.
We don't have a plan for the unit to be operating this weekend, but we are working with Kim at the health department in Crete, as well as Pat with the health department here in Lincoln. And we're going to start to set up a schedule of where they feel the best spots for us to locate over the next several weeks. So we're still working on that, and you guys will be hearing more information as we work with different centers and different populations throughout these communities. That's going to give us the best opportunity to give access to individuals to be tested. We have been getting our results back under 48 hours, so I would say we'll probably be receiving those on Sunday.